let me put you in a different role. I just made you the head of Penn University Health System. Congratulations on your promotion or demotion. I don't know. You probably have a pretty good work life and balance right now. But I'm going to put you in charge of a health system. Very challenging situation to be in right now. You're worried about the fact that you have a lot of traveling nurses filling in gaps for nurses that have left and gone to work for you because you have a great work environment and you're giving them the ability to do the thing they love doing. How are we going to stem the tide of nurses just walking out the door so that we can continue to provide care in Philadelphia?
Well, thank you for the new title. I'm not sure it's one that I've wanted, but there's a lot of factors that are implicating these staffing decisions. One thing that I've read a lot about recently is how the travel nurse industry and supply chain are also impacting the high costs going into these staffing decisions. And when nurses are leaving, quitting in droves, then how might we also align our supplies and staffing? So the cost for staffing agencies, travel nurses to supplement the nursing shortage is very, very high. So in order to make significant change, there needs to be a fundamental shift in the way that we treat and compensate our healthcare workers. I know that this has been making headlines in California and elsewhere, but how might we value those that are full-time on staff or even part-time on staff the same way we value those that are traveling to fill gaps in our health system? And I think that's a fundamental issue that needs to change based on some recent events, but making sure that the physicians and clinicians, when they arrive, have the supplies that they need to do the job, because that's also part of how we value them and how they feel good about doing their job. It's not just about making sure that they have a team to rely on. It's also about how that they have the materials, the tools, the resources that they need to execute. So it's kind of a balance between reevaluating the compensation, but also making sure that those tools and supplies are available as well. So I might also tag my COO counterparts and other CFO counterparts to make sure that we're thinking about this more holistically in terms of bringing patient care to the forefront and balancing that with, really getting at the heart of why our nurses are leaving. It's not just about pay. It's certainly a big part, but it's about that evaluation of how are we failing them. And it's seeing the competition getting paid higher. It's seeing, packages of materials and tools not arriving because of supply chain shortages. So how might we better plan from the get-go?